So somebody asked us to just go over the mechanisms of diabetes causing neuro-ophthalmic disease, and for us that's going to be ischemic complications either related to diabetic retinopathy, and there's two forms, the non-proliferative diabetic retinopathy or the proliferative diabetic retinopathy. These are separated by the formation of neovascularization. And the other ischemic complications are going to be small vessel, microvessel ischemia, and that can come to neuro-ophthalmology either as non-arteritic anterior ischemic optic neuropathy, oculomotor cranial neuropathies, or stroke. And so the interesting thing about these downstream complications is they're all related to elevations in the glucose level. So that hyperglycemia, and sugar is normally good for you, so that hyperglycemia leads to non-enzymatic glycosylation of proteins. And basically all that means is the carbohydrate, the sugar, is going to connect to the protein, the amino acids. And it's not really important that you know which amino acids, but when you have non-enzymatic glycosylation, it's going to go through a series of biochemical reactions that are going to lead to advanced glycation end products. So the normal, within hours, you get a Schiff base formation, and then over time, if you leave it, the sugar in there, you'll get an Amadori product. And one of the more famous Amadori products is the hemoglobin A1C. And so persistent elevations of the blood sugar lead to glycosylated proteins, including the glycosylation of hemoglobin. And that means we can use the hemoglobin A1C to tell us what the sugar has been doing for the last several months. And if you leave it long enough, it'll become irreversible. So these steps still can go backwards in time. But once you get past the Amadori product, then you're getting to the age, which is the advanced glycation end product. The advanced glycation end products have a whole different sorts of names: CML, DOLD, GOLD, MOLD. There are a whole bunch of alpha oxoaldehydes that are advanced glycation end products. You don't need to know all their names, but they will bind to the receptors for the advanced glycation end products, and then those will lead to a final common pathway of reactive oxygen intermediates, matrix metalloproteases, and damage where the target cell is the pericyte. And the pericyte is like the buddy of the endothelial cell. And so if you damage the pericyte, his friend, the endothelial cell, which forms the basis of the blood-retinal barrier and the blood-brain barrier, will be damaged. And if you damage the blood-retinal barrier, blood, fluid, and exudate will come out of the blood vessel into the retina. This we call non-proliferative diabetic retinopathy, because we're going to see the hemorrhage, we're going to see macular edema, we're going to see the fluid and the exudate. Over time, that leads to microvascular ischemia and small vessel occlusive disease. In the initial stages, you'll get microaneurysms. There'll be dilation in response to the ischemia, but over time, the ischemic retina will start to produce vascular endothelial growth factor, and that will lead to the production of neovascularization either on the disc, NVD, or neovascularization elsewhere, or on the iris, NVI, and that transitions from the non-proliferative form to the proliferative form of diabetic retinopathy. This neovascularization is not a very good blood vessel. It'll bleed, or it'll cause a tractional detachment, and this is what causes the blindness, and so we often have to kill the sick retina either with pan-retinal photocoagulation, which is laser, or we try and reduce the VEGF with anti-VEGF agents, which is delivered intravitreally. The small vessel ischemia that we see in NAION and small vessel ischemia in the brain that's causing those strokes is also a manifestation of this cascade. And so the biochemical mechanism of diabetes is hyperglycemia, leading to non-enzymatic glycosylation, passing through the irreversible forms, the Schiff base, the Amadori product, reaching the end stage, advanced glycation end product, binding to receptors for age, leading to reactive oxygen intermediates, inflammation, yada, 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 peroxidation, endothelial death from parasite damage, and both non-proliferative and proliferative diabetic retinopathy.